Hello, I am Dr. Martin Rutherford. I am a certified functional medicine practitioner and a chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So we're going to speak today. We're kind of going back to our roots here at the beginning of this year, because essentially we really started off with fibromyalgia, peripheral neuropathy, and I think it was dizziness and vertigo and balance when we first started doing this. I think those were the issues that we started with. So we're going back to our fibromyalgia roots here the last couple of weeks. And we're going to talk about fear of activity. And it's an interesting topic because the fibromyalgia patient has many vicious cycles going on in their system relative to overfiring fight-flight mechanisms, bad gut problems, autoimmunities, frequently, if not always, having Hashimoto's thyroiditis, and all of these activities, all of these chemical reactions and neurological reactions work to damage your body's ability to be able to create energy and to be able to withstand stimulation. Meaning, if you do too much, you crash. Or if you do too much, you can, or if you try to read too much, you don't have maybe the endurance that you used to have, or you have a good day and you go out and you do a bunch of things and all of a sudden you don't feel good for 2 or 3 days. We have a term for that here. I think it came from the functional neurology world, if I'm not mistaken, and we call it exceeding your metabolic capacity. In other words, your body has 9 systems and they're designed to work in such a way that we should be able to create enough energy to be able to go through the day and do the things that we need to do properly, as long as we don't overdo it. Even absent of fibromyalgia, you can overdo things, okay? But in general, when everything's working, our metabolic capacity should be enough for us to get up, go to work, take care of our kids, go home, get a good night's sleep, and so on and so forth. For fibromyalgia patients, because you have these different conditions that are either not allowing the little mitochondria in your cells to make enough energy, they're not supplying your brain with proper oxygen or fuel. They're doing a lot of things to damage your ability to go through that day at a normal capacity. So the capacity of the, frankly, most chronic patients, but the fibromyalgia patient seems to be like right up there. And fibromyalgia and chronic fatigue are like this. For these patients, your capacity of your brain and your general metabolic system, if normal's here, your capacity's here. So when you do something to exceed it, you crash. So there's a wisdom in maybe realizing that if you feel good that day, that you shouldn't exceed your metabolic capacity and go crazy and do things. But Dr. Gates is going to share with you data and our observation through the years that's probably also not good to do nothing and to fear that if you do anything, you're going to crash. So there's a balance in life. Even when you're ill, there's a balance that it's best to maintain. And Dr. Gates is going to take my glasses off today, because once I get done with this, I'm not going to have much else to say here. But that this fear of activity kind of can serve to maybe create more of this poor metabolic capacity as time goes on. So I hope that isn't confusing. I hope that kind of sets up where he's going today. And so fibromyalgia, fear of activity. Dr. Gates informs me that this first came about with people who had bad backs and didn't want to do anything. They were, and how that evolved into a much wider understanding of this subject.
Absolutely. And for those of you watching who haven't watched our other broadcasts, you can go back and access our other fibromyalgia broadcasts on powerhealthtalk.com. We have discussed fibromyalgia at length, probably as much as anyone out there. I can't validate that because I haven't compared, but we've talked about it a lot. And we attach a lot of research articles to what we bring to the table, so to speak. So on powerhealthtalk.com, below our broadcast, you can always access those. And we're going to be doing a webinar on fibromyalgia rather soon to kind of make all that information that we put out there, the disparate pieces, so to speak, putting it together so you can understand it basically within an hour to hour and a half. Now today, talking about fibromyalgia, this is something that we encounter in our clinic in terms of fear avoidance, because we work with patients with fibromyalgia who then go from being basically incapacitated, depressed, horrible pain, horrible fatigue, bad IBS, to a point where then they get their life back. But lots of times once they get their life back, once all those symptoms are away, it's almost more of a challenge at that point to kind of take that leap back into activity, as Dr. Rutherford was saying. And so what we have to do is kind of look at where you're at when you're better, or even if you are still over here, we have to consider fear avoidance as well, because lots of times that's prohibiting you from doing really anything, and it may be making the condition overall worse. So as Dr. Rutherford mentioned, we were going to talk about low back pain. So that's really where fear avoidance got its name. And they saw it in patients who had really bad lumbar spine injuries. So people who throw out their back, so to speak, or they bulge a disc. And after doing this, they were almost immobilized and they didn't want to move at all. And they didn't want to go mow the lawn, so to speak, or they didn't want to go help their son move because they're afraid of hurting their back, understandably so. But when we develop that psychology, what we know is that really, if you don't use it, you lose it. They've seen time after time after time in the low back that the muscle atrophies. Right. It goes from looking nice and dense to basically the analogy would be, it goes from looking like a filet mignon to looking like a ribeye steak. So all of a sudden it has lots of fat in it, scar tissue in it, and it's not a functional muscular unit, so to speak. Well, the same thing applies to the fibromyalgia patient. They started seeing the same overlap with fibro patients and people with TMJ issues. And the fibromyalgia patients, they see that there's just this high level of anxiety associated with activity. Right. And really what it boils down to is that what we've seen, and we're not telling you to do this if you're not our patient, but what we've seen is that you have to create kind of a graded system for bringing that person back into daily life. So if they used to work 8 hours a day and they have been working for 5 years, we'll have them work for a half hour or an hour a day for a week. Just get into a routine so that they can get some of that activity back with the expectation that, yeah, you may have a little bit of a setback. But in this graded system also, it's not as though you went from doing nothing to doing everything, and then all of a sudden you crash for 2 weeks, like so many patients say to us.
More common than not, I think.
More common than not, and that's the exceeding the metabolic capacity term that Dr. Rutherford mentioned as well. And so with doing this, in the literature, they discuss cognitive behavioral therapy. So just know that the premise of cognitive behavioral therapy is that if you have an anxiety about anything, they just throw you into the fire. So some people have severe panic over flying, and a therapist will get on a plane with a patient, and the patient will be having a panic attack, and basically they just coach them through it. And then after the person gets off the plane, they realize, oh my gosh, I flew, it wasn't that bad. And so really that same premise applies to you as the fibromyalgia patient. So especially for those who are having success and feeling better, the idea is, okay, what are you afraid of? Are you afraid of doing the dishes? So could you maybe load a fourth of the dishwasher and then take a break and then see how you do the next day? That's the idea in terms of fear avoidance. But it's something really to be aware of, because all throughout the literature, scientists are talking about this topic as it pertains to fibro sufferers. And this is one of the really the main reasons why you continue to have pain. A lot of you have been told to exercise, which is kind of the gold standard treatment now for fibromyalgia. But a lot of you say, if I exercise, I hurt. If I exercise, I crash, I'm in pain. So again, it's that graded system. And it's a matter of saying, okay, I'm gonna exercise and I'm gonna try and keep my anxiety to as minimal as possible, because they found that those patients who approach the exercise with the least amount of anxiety really have the best results in terms of their pain not being exacerbated. So that's really the gist of this. In terms of prognosis, just know that when scientists are evaluating fibromyalgia patients, if they see this fear avoidance syndrome come up in your history, to them that indicates you're going to have a worse prognosis, which basically means you're going to suffer with it the rest of your life. You don't have a chance of getting out of this
Well, I mean, every time
fibromyalgia.
you go into fear, you're going to flood your system with
Stress
all these
hormones,
stress
exactly.
hormones. And I mean, it's going to be cortisol, it's going to be adrenaline, and it's going to be epinephrine and norepinephrine. It's going to alter your blood pressure. It's going to alter everything. I mean, so you're perpetuating one of the main mechanisms that caused the problem in the first place.
Mm-hmm.
And I'll share, if there's any of you who are watching this for the first time, I developed fibromyalgia along with a number of other things, peripheral neuropathy and celiac and Hashimoto's and chronic fatigue years ago. And I never really had fear, maybe because I was really motivated to work. We won't get into that. But I had a lot of motivation to get back to work. I was out for like 3 weeks, which doesn't seem like much to a lot of you, I'm sure, because a lot of you have been out for years. But I and you've watched me do this over the years. I would just test the boundaries. How far can I go, and how much can I do? And if I couldn't do it, I couldn't do it. Then I would stop. And then even outside activities, when I first got fibromyalgia, I'm like a rockhead, so I'm going to go out and still play golf, and I walk, and man, I mean, I couldn't make 5 holes, and my legs would be killing me. And so slowly I extended as I got better. Even to this day, if somebody sees my door closed here at the office, it's because I'm taking a 5-minute, 10-minute, 15-minute nap, because we work kind of like patient after patient after patient. And I have a certain capacity, and I know now when I get to that capacity, stop, rest. The staff has scheduled around me. They don't pack me the way that they used to do. So, I mean, you can kind of test the water a little bit. If you have a good day, as Dr. Gates just said, what the research said, go to the store, come back, don't do anything else, see what happens. I mean, that's kind of what I did. I'm pretty much where I'm going to be, but I'm functional, and I'm not working. Thank God, I'm not working 50 hours a week anymore, and I'm not even working 40. I don't think. I'm probably working like 30, 35 hours. But that's better than not working, and I feel good. And over the years, I keep getting better. So because I'm not engaging these stress hormones continuously, I'm not crashing continuously, because each time you do that, you go backwards to some degree, chemically and neurologically. So just share like that, even without a fear-based response. I think that is a good potential approach for those of you who might have been attracted to this subject because you've been wondering how to maybe get out of this and get back to living a normal life. And realize that, I would say last thing, you can realize that you're going to have limitations, but that it's going to be like a zillion times better than where you are, like when you're really sick and hurting all the time and so on and so forth. So, and that acceptance helps a lot, because sometimes you'll push to the point where you think you got to get back to where you were before. And if you have an autoimmune problem, that's not likely, but you can get back pretty close. You can get back pretty close. I don't know if that was, I think that was kind of relevant.
Yeah, absolutely.
Okay.
Absolutely.
All right. Just, a little practical aspect to it there. So, yeah.
I think this pretty well covers it.
Okay.
Yeah. So again, look forward to that webinar on fibromyalgia. We're working on it actively, moving along. So we'll have that coming soon. And if you have any questions, send those to us at powerhealthtalk.com. Again, you can find references for today's broadcast and other references for other broadcasts on powerhealthtalk.com. And if there's any topic you're wondering about, put it into the search tab and probably it will pop up, because we've talked about a lot. So thanks for watching, and we'll see you next week.